use the toileting of the bedridden patient is healthcare facility usually made a metal, glass, or plastic receptacle. A bedpan can be used for both urinary and fecal discharge. So the purpose is many diseases can confine a patient to bed and necessitating use the bedpan. So additionally, many patients will be confined to a temporary result for the temporary illness, injury, and surgery, thereby necessitating the use of the bedpan. So the first suggested actions and principles or rationales is wear disposable gloves. I have a equipment. First, bedpan, 2 towels, tissue, paper bag, alcohol, and spray. And also the warm water in the pan. So first is if the bedpan is metal, it is by rinsing with the warm water. Adjust the bed to the upper weight height to prevent back strain. Elevate and side rails to open opposite side, so to prevent the client from falling out of the bed. So let me assume the bed is so already appropriate for the height to elevate the side rails, so it is okay. So ask the client to assess by flexing knees, twisting the weight on the back heels, and reaching buttocks by the using trapeze bar or 8%. So help lift the client as needed by placing one hand under the lower back, resting your elbow on the mattress, and using your forearm as a lever. So I'm going to first fix the knees of the patient and the one hand of the patient in the buttocks. So lubricate the back of the bedpan with a small amount of hand lotion or liquid soap. So let me assume a small amount of hand lotion is okay for the patient to reduce tissue pressure and shearing. So by using my one hand, so place the regular bedpan so that the client resting on a smooth, rounded hip, and place the sleeper pan of the flat, low, and under the client buttocks. So I'm going to use my one hand and ma'am, 1, 2. Okay lang po, ma'am? So for the client who cannot obtain the assistance of another nurse or placing the client her side, so the patient is already done for the placing the bedpan. So to help the lead one into a bedpan, so elevate the client's bed semi-powder position. So to permit it, the elevation is contributive or support the client back with a pillow as needed. So to provide a more normal position, the client lower back to prevent the hypertension of the back. So ma'am, taas lang po natin. Okay lang po yung position niyo. So, cover the client with a bed line. So to maintain the comfort of dignity. So ma'am, baba ko na po ito. Komportable po ba kayo sa inyong position? So, provide the toilet tissue placed with a cold light within a lower bed of the low position, elevate the side rail if indicate the leave in the client alone. Then answer the call of the bed complete. So do not leave anyone on the bedpan longer than 15 minutes. So let me assume that the patient is already done for the pupo or sa kanyang pag-remove ng kanyang dumi sa kanyang katawan. So let the stay on the bedpan and cause the pressure ulcer. So ma'am, nilalagay ko lang po ito dito. Then, pag okay na po kayo sa inyong pagpupo, pakitawag na lang po ako. Okay po. Okay ma'am, are you done? So when removing the bedpan, return with the position using the giving a bedpan, hold the bedpan steady, cover the bedpan and place the in another place for the adjustment of the chair. So holding the bedpan steady prevents spillage of the content. So ma'am, i-remove lang po natin. So if the client needs assess for if you glap with the white of patient, so several layers of the toilet with a specimen of proof that place the tissue with the receptacle of the client. So wash the peritoneal area of the defendant patient with the soap and water and thoroughly dry the area. So ma'am, ito po yung soap. Okay lang po na mag-wash po kayo ng hands niyo. Okay lang po. Then using alcohol. For all patients, offer one water soap or the washcloth and a towel to wash the hands so that the patient already done for the warm water soap and washcloth the hand. So assess the patient to comfortable position, empty the client, bedpan, then return it the bedside, remove the discard, the gloves and also wash hands to prevent spread of infection. Okay, ma'am. Are you comfortable, ma'am? So next, I'm going to remove the gloves. So I'm going to wash my hands to prevent the spread of infection. When I wash of my hands, so spray the room for the prisoner or as needed to control other useless that contain that because of the respiratory problems or allergies. So document color, odors, amount, and consistent urine and the condition of the peripheral area. So ma'am, thank you and be comfortable with your bed. So thank you again and I'm your student nurse for today.